So we get a lot of people come in who hurt their back or hurt their neck and they don't have a reason for it. And they find it a little bit confusing that they will say to us, I don't know why I've hurt my back, I haven't been doing anything lately. And that's actually super common. And I think it really helps to understand that the reason you probably don't remember what you did is the actual initial injury may be incredibly minor. If you think when you roll your ankle, often there was, or any big gross injury, there's often a point in time that you remember. You twisted your ankle, you felt a snap, you feel sudden intense pain at the time of the injury. But with our back and our neck, that often doesn't happen. Some people might move the wrong way and feel a little bit of a slight discomfort that wasn't a problem until later in the day or the next day. And I think that helps us understand that probably the initial injury isn't that severe. And the reason why we're getting a lot of pain is probably more so due to reactive inflammation, muscle guarding, and then this neural system protective overdrive that our body does, because kind of back pain's a bit threatening. We're a bit concerned by our backs hurting. We hear lots of stories about people having problematic backs, and we think that goes a long way to causing pain for people. So I decided that I was going to track people's onset of back pain and record it. I thought that would be quite educational for some people. As you can see here, it's messy, and that's because I actually started this back in October, which I think is important. Before we go on, let's just neaten this up a little bit. Alright, so there we go. Now the reason I had to tidy that up is because I actually started this in October, and that's a lot of people rubbing against this whiteboard in the last 8 months. It's now May. So if we break this down, we have 3 people with acute neck pain that was triggered by an event. We have 11 people who have no reason for it, no apparent reason, and 9 people woke up with it. For the lower back, we have 10 people triggered by an event, 10 people for no reason, 5 people woke up with it. I think if we combine waking up with it with no apparent reason, we're really looking at 15 people which have no reason for their back pain starting, 10 people that have an event. With the neck, 9 people woke up with it, 11 people, 20 people versus 3. I don't think you can necessarily say that waking up with it is a non-event. I think it's interesting that a lot of people wake up with neck pain, and perhaps that's because overnight they have a particularly deep sleep and don't roll or roll out of uncomfortable positions as much, but that's just a theory that I have. I think a lot of the times we see a trigger from an event, particularly for back pain, all of those people tell us it's something that they didn't usually do. Maybe they don't do a lot of gardening, and then on the weekend they did a whole heap, or they pulled out some weeds and they were really sore afterwards. But most of the time, the onset of pain wasn't sudden. They did something they weren't used to, played a game of tennis that perhaps it was a social game they don't play a lot, and then afterwards they started to get really sore. So even some of these, it's hard to specifically say that it was triggered by that event. But the main thing that's important there is there's usually a lack of capacity for that event. So then once we settle down their pain, or your pain, we then have to build up capacity with strengthening and functional exercises relative to what you're about to do. But the other thing that's really important with this, I was putting heaps of lines on this whiteboard in October and November. In December, January, February, I was barely marking this whiteboard. We were seeing lots of other things. But in the last 3 or 4 weeks, I've got that pen out every day. Oh, another episode of back pain, another episode of neck pain. And that lines up with the colder weather. Now, this is a very small sample size. We can't really put that to the general population, so that can just be chance. But if we make the assumption that this is relevant data, that is something that we see a lot of. And I think it correlates not with the fact that your body is cold. It relates to the days being shorter, and instead of going for an 8:30, 9 o'clock walk and watching the sunset, we're at home at 6 o'clock watching TV because it's already dark and wet and cold and raining outside. So that point that a lot of people come in here and say to us, I don't know why my back's sore, I haven't been doing anything lately, that's what we see all the time. So really they're answering their own question. My back is sore because I haven't been doing anything lately. The more we get people up and moving about and active, the better that they go.